My name is Kayla Gursky, and I'm focusing my paper and my project on students with traumatic brain injuries. So the objectives of this PowerPoint are to define what a traumatic brain injury is, explore the causes of these injuries, discuss the symptoms that people with brain injuries may display, note the prevalence of traumatic brain injuries, discuss the changes that we may see in students with this type of injury, explore how traumatic brain injury is different than being learning disabled or emotionally disturbed, and to note some teaching strategies for students with traumatic brain injuries. A traumatic brain injury is an injury to the brain when the head has been hit or struck by something, or if it has been violently shaken. IDEA of 2004 defines a traumatic brain injury as an acquired injury to the brain caused by an external physical force. The injury results in total or partial functional disability or psychosocial impairment, or both, that adversely affects a child's educational performance. The term applies to an open or closed head injury, and these injuries result in impairments in one or more of the following areas: cognition, language, memory, attention, reasoning, abstract thinking, judgment, problem solving, sensory, perceptual, and motor abilities, psychosocial behavior, physical functions, information processing, and speech. There are three types of brain injuries. The first is a closed brain injury, which result from a non-penetrating blow to the head. The second is the opposite, an open brain injury, which result from the skull being fractured or crushed. And the third is a non-traumatic brain injury, also known as an acquired brain injury, which result from internal causes such as strokes, tumors, etc. This chart from the CDC shows us the causes of traumatic brain injury. The leading cause is from falls, which is 40% of all causes of traumatic brain injury. Next is unknown or other causes, followed by being struck by or against an object. Next is motor vehicle traffic accidents, and finally assaults. So those are the leading causes of traumatic brain injuries. Here are some symptoms that people with traumatic brain injury may display. Physical impairments can include speech, vision, hearing, headaches, motor coordination, spasticity of muscles, paralysis, seizure disorders, balance, or fatigue. Some cognitive impairments may include short-term memory deficits, impaired concentration, slowness of thinking, limited attention span, impairments of perception, communication skills, planning, writing, reading, judgment. Emotional impairments may include mood swings, denial, self-centeredness, anxiety, depression, lowered self-esteem, sexual dysfunction, restlessness, lack of motivation, and difficulty controlling emotions. The prevalence of traumatic brain injuries in the United States is that an estimated 1.7 million people sustain some type of traumatic brain injury annually. 52,000 of these people die, 275,000 are hospitalized, 1.365 million, or nearly 80%, are treated and then released from an emergency department. And traumatic brain injury is a contributing factor to a third of all injury-related deaths in the United States. So here are some things we may see in a student with a traumatic brain injury. Students with brain injuries may display behaviors or characteristics that resemble other disabilities, which can make it very difficult to diagnose at times. Numerous tests and evaluations should be used to determine the student's strengths, needs, areas of deficit, and etc. Because each injury is unique and affects each person differently, it can be difficult to pinpoint exactly how the person will be affected by the injury and what the long-term difficulties may be. According to a study done by Hibbard, Gordon, Martin, Raskin, and Brown, some of the changes in the student that we may see include physical changes such as tiredness, lack of interest, headaches, awkward movements, slowed reactions, heightened sensitivity to light or noise. Cognitive changes may include forgetfulness, sudden failure in learning new material, word-finding difficulties, problems with organizing materials, inattention, easy distractibility. Emotional changes may include moodiness, lability, depression, and anxiety. Behavior changes may include irritability, aggressiveness, inability to deal with unexpected events, and easy frustration over minor incidents. So like I said before, traumatic brain injuries can display characteristics similar to other disabilities. So students with specific learning disabilities and students with traumatic brain injury both may demonstrate difficulties with impulse control, difficulties with generalizing and integrating skills, inappropriate behavior due to poor social judgment, difficulty with sustained attention, and a need for memory aids due to the difficulties with short-term memory. But then, students with traumatic brain injury may also display problems that are more exaggerated and severe, more extreme discrepancies among their abilities. They may demonstrate more uneven and unpredictable progress, and they have been conditioned to rely on old strategies for learning. They have the ability to relearn old material, therefore they may learn faster at times. They have the potential to improve and regain their function, and their deficits are not developmental. So now, traumatic brain injury versus emotional disability. Both of these students may demonstrate inappropriate behaviors in social settings, an inability to maintain relationships with peers and teachers, a general pervasive mood of unhappiness or depression, difficulties that are sometimes unseen and unanticipated. Students with traumatic brain injury may have a pre-morbid self-concept of being normal. They have an ability to relearn their old information. It's the new learning that is more difficult. They often have a combination of conditions which do not easily fall into categories of disabilities, and they have their potential to improve and regain function. Here are some teaching strategies for working with students with traumatic brain injury. First, talk with the family to learn as much as possible about the individual and also their injury. Always keep it positive both inside the classroom and out. These students may need some extra support since they do have difficulties in learning and memory, and often these students do remember themselves before the injury had happened. Collaborate with colleagues, that way all teachers are on the same page and are familiar with the student's strengths and needs. You may need to modify your teaching style and pacing to accommodate the student. Decrease the student's negative behaviors by use of positive behavior supports. Increase communication both with the student and the student's family. Redirection when the negative behaviors begin occurring, and reinforcement of the positive behaviors. Having structure, consistency, and repetition throughout your classroom and throughout the lessons. Set reasonable expectations so that way the student can be successful. Allow rest periods or break when the student needs it. Find the student's strengths and allow them to be successful. And also, one of the big things I read over and over again is just having consistency within your classroom. Here's just a list of appropriate standardized tests that may be helpful for determining a traumatic brain injury or determining the strengths and needs of the student with the traumatic brain injury. There are different achievement tests, adaptive behavior tests, attention scales, intelligence rating scales, and tests, and language ability scales. And since traumatic brain injuries are an acquired injury, the CDC gave a list of some preventative measures that may help to avoid the risk of someone suffering from a traumatic brain injury. These include buckling children into safety seats when in vehicles, wearing a seatbelt every time you are in a vehicle, never driving under the influence of alcohol or drugs, wearing a helmet when riding bikes, skating, skiing, horseback riding, or playing contact sports, making your living areas safer by removing tripping hazards, installing handrails on staircases, and improving lighting, installing window guards to keep children from falling out of windows, and having safety gates near the top and the bottom of staircases when young children are around. And here's a list of all of the references that I used for writing my paper and also for this presentation.